Welcome back to 3+U. An irregular heartbeat is something that millions of people have. A lot of people don't even know they have it, but it is something that can lead to some big-time health problems. Here to break it down, we have Dr. Kelly Richardson. She is with the Chattanooga Heart Institute at CHI Memorial. And Dr. Richardson, we're going to talk about this new procedure called the Watchman, which can help some folks with an irregular heartbeat. But let's talk about irregular heartbeat, also known, I guess, as AFib.
Correct.
Talk about what that is, first of all.
So atrial fibrillation it's the most common arrhythmia. Basically, instead of having the upper chamber beat and the lower chamber beat, the electrical signals in the upper chamber, there's hundreds of tiny little electrical circuits in the upper chamber that cause the heart to be very irregular and typically fast, but not always.
And it's something like that. Whenever I hear irregular heartbeat, it doesn't alarm me, and it seems like it's something that people just live with. Are there different kinds, different levels?
So some patients are asymptomatic, in which case that they can live in AFib and do very, very well. In some cases, patients are extremely symptomatic, have a lot of fatigue, shortness of breath, really can't have a really poor quality of life, in which case we try to get them back into normal rhythm and stay in normal rhythm. So there's lots of different ways to manage AFib, and a lot of that depends really on symptoms.
And we were talking off air, and anticoagulants, that's the primary treatment or now and has been?
Yes, so there's when you look at AFib, you break it into two different parts. One is the management of the AFib itself, and then the biggest risk with atrial fibrillation is the risk for stroke. And so on that side is the anticoagulation management, and most patients require some form of anticoagulation to reduce the risk for stroke.
Okay, but some people cannot take the anticoagulants for whatever reasons. What are some of the reasons? And then let's also get into the brand new procedure that can help out with that.
Sure. So with atrial fibrillation, the upper chamber is sort of quivering. It's not actually pumping, and that allows for blood to coagulate and form a clot. And then if that clot gets dislodged, it typically goes to the brain and causes a stroke. 90% of those clots form in something called the left atrial appendage, which is an outpocketing from the left atrium. And so patients require anticoagulation. However, there are a lot of patients who can't take anticoagulation for GI bleeding risks, previous head bleeds, fall risks. So those patients for the longest time have had to live with this high risk for stroke. But now we have a device that actually occludes the left atrial appendage so that those clots that are inside the left atrial appendage can't get out and go to the brain and cause a stroke.
So this is called the Watchman, and this is cutting-edge technology. Aren't you glad you live in 2019? Is this something that's already being implemented? Tell me about some of the things that you've seen with some of the patients that have received this.
So a lot of the patients are extremely thankful to be off anticoagulation after the procedure. It does require short-term anticoagulation at the time of the procedure, and then for a minimum of 45 days afterwards. And then we switch to some different types of blood thinners for another 4 or 5 months, and then we stop it. But patients are extremely happy when they're told you can stop your anticoagulation, and now their risk for stroke is equivalent to being on anticoagulation.
So is this something that if someone is asymptomatic, they're just living their life, they're watching this and thinking, you know, I think I'll go get checked out. Maybe I do get a little more tired than I think I do. I think I will go get checked out for AFib. It's diagnosed that they have it. Is the Watchman something that they would go ahead and immediately have, or is that something that you only do at a certain level?
Right, so it's not for everybody. If you can take anticoagulation is still what we recommend. Okay. It's mainly for those patients who have a contraindication. The guidelines say a reasonable rationale to seek an alternative. So it's things like bleeding or fall risks and those sorts of things. For somebody that does get the Watchman procedure, is a long hospital stay? How invasive of a surgery is this? So it's a minimally invasive procedure where we go in through the groin and run the catheter up into the heart. It's done under general anesthesia. The procedure itself only takes about an hour, and then patients are observed overnight and typically go home the next day. Recovery is actually fairly quick because it's just a little stick in the groin, and they're able to get back to their regular activities pretty quickly. It is amazing where medicine is now. The Watchman, this is
the Chattanooga Heart Institute at CHI Memorial, which in my opinion is, I mean, it seems like we have some of the most leading technology going on.
Definitely.
And we're fortunate to have it. We're fortunate to have you here, and I'm going to brag on you for just a second. We only have a few minutes left, but a GPS grad, and rattle off all the medical places that you trained and studied.
So I did my medical school at Vanderbilt, and then I did my residency at Harvard at Mass General, and then went to Stanford for my fellowship in cardiology and electrophysiology, as well as biodesign, and then I recently moved back home to Chattanooga.
I love it, and I love that you're back home, raising 3 kids, doing it all. Doctor, thank you so much. Again, it's called the Watchman. If AFib is something that you even think might be an issue for you, please let me encourage you. Call the great folks out at the Chattanooga Heart Institute at CHI Memorial. There is the phone number and more information available on this and lots of other stuff regarding your heart, ChattanoogaHeart.com. Dr. Richardson, thank you for coming on.
Thank you.
We'll take a quick break. We'll have more 3 Plus U right after this.